Hey guys, Dr. Andrew here from Chiro Wellness Centre, and welcome to today's episode of the Chiro Couch. Now today I want to talk to you about pinched nerves. How do you know you've got a pinched nerve? Can you test for a pinched nerve? And what do you do if you have a pinched nerve? But let's start with the brain, because the brain communicates down the spinal cord, and out of these little holes come these nerves, and that's the most common place that you can have a pinched nerve. It's pinching and becomes unhealthy because either there's compression on the nerve or compression on the blood supply to that nerve, and the messages flowing backwards and forwards get less. I guess it's just like a highway. You can have traffic jams, you can have closures of lanes, and the closure of lanes will affect the movement of traffic, just like it'll affect the movement of impulses. Now regardless, it will stop the organ and muscle behaving the way it should. Now, normal healthy nerves can be tensioned and compressed to some point, but research says that only a 5-cent piece resting on that nerve can affect its function by 60% in just 3 minutes, and if you leave it there, it can end up dying. So it's very important to look after your nerves. Now, some of the symptoms that you might get from compressed or pinched nerves might be electric burning sensations, tingles, pins and needles, lack of temperature, or long-term aches to other areas, and they're referred, which means the problem could be here but you feel it somewhere else. Have you heard of sciatica, for example? These are pinched nerves at the lower back because of either bulging discs or misalignments, but they can also be pinched at the muscles that travel down your leg, like the piriformis muscle. And if you Google a term called dermatome, these patterns will show you what pinched nerves look like, so check that out also. Now another one is arm pain, because that travels from the shoulder down the arm and could go into the hands as well, coming from the neck. Let me give you an example. In the neck, there are 8 nerves here, each coming out of these holes, and they travel down your neck to the fingers. Now if you're getting pain in your hand or fingers, each of these correlate to a different nerve. For example, C6 can affect these ones, C7 can affect these 2 ones, and C6 will affect your little pinky. But the most common one is at C6-7, or these 2 fingers, because it is the smallest hole out of that level, and it's also the one that's injured during whiplash injuries. And the whiplashes can occur at 10 kilometers an hour. But to finish off, there's 3 most common causes of pinched nerves. So as I said before, there is a bulging disc, there is a subluxation, but it can also have degeneration, and these little spurs can push into these holes and affect the nerve's function. Now, unfortunately, if that's the case, you may not recall when you actually pinched your nerve, or there might be other times where you bend over and pow, you feel it straight away because the pain is fast and strong. Now, if you might have a pinched nerve, first you've already got to check with your health professional, okay? Now, you can look up the dermatomes to try and work out which ones it is, but your health professional will probably take an x-ray or do an MRI to confirm exactly which one's compressed, and so we can properly treat it based on the type of compression. Now, if you're watching this and you might have pain right now, my first advice was to try ice or heat. If it's inflamed, ice will give you some relief. And if you can stretch your neck or your lower back, stretching relieves muscle pain, but it doesn't relieve nerve pain. Regardless, I'm here to help you. So if you have any questions, please, or if you know somebody who might have a pinched nerve, comment their name below so they know more about me, so I'll do my best that I can help them. My name's Dr. Andrew from Chiro Wellness Centre. I hope you learned more about pinched nerves, and I'll see you next week on the Chiro Couch. Bye for now.